The best way to look at an implant and to see whether it's intact is an MRI. An MRI can tell whether the shell is intact or whether the shell has broken. And there's certain findings on an MRI called the Linguini sign and others that might suggest the implant has broken down. There are some ultrasound machines which are marketed to plastic surgeons that claim that they can also look at an implant and see whether it has broken down or not. We currently don't have those devices, but there are local ultrasound clinics that are performing that service as well. If an implant were to break down, first of all, the clinical term for that is rupture. But I'm not a fan of that term because it sounds like a rupturing volcano. It can't explode. If an implant were to break, it's possible that some of the silicone gel could leave the implant surface and either be on the surface, that's called gel bleed, or to remain inside the implant capsule, and that's called an intracapsular rupture. Most ruptures of implants are silent, and there's usually no symptoms associated with them. So in the big picture, are they risky? No, not really. However, if you've had implants for a long time, if you do imaging and it shows that the implant shell has broken down, then I recommend that you see a board-certified plastic surgeon so you can learn all of your options. Options, if you find that you have an implant which has broken, would be number one, to observe it. If you are not having any issues, if you still have good symmetry, if you haven't developed hardening of scar tissue called capsular contracture, it's okay just to watch and wait. Another option would be to go back to the operating room to remove that device and put in a new one. And depending on how long it's been since your implant surgery, your implant might be covered under warranty. A third option would be to simply have removal of your implant. And depending on the situation, whether you have capsular contracture or not, it might be as simple as removing your implant under local anesthesia. If you do develop capsular contracture and if leaving the internal scar tissue in place would create deformity, then sometimes we recommend a capsulectomy at the same time, and that generally requires general anesthesia. Other things that I think are important to know, there are 4 different implant brands at present, and this is my current favorite, Sientra. In all of the biomechanical studies, this implant is the most durable, it has the lowest rupture rate. It's a small company. They only manufacture silicone gel breast implants. They only sell their device to board-certified plastic surgeons, which I really appreciate because I also operate at very high standards. They offer a 20-year warranty on their device, whereas the 3 other breast implant companies only offer a 10-year warranty. Lastly, I have had a breast augmentation myself, and I blogged about it. If you visit my blog, you can learn all about my plastic surgery experience. And I go into detail. How did I find a plastic surgeon? What was the recovery like? How did I speak to my daughters about having surgery? And how do I feel now, 6 years later? So for more information, visit my website and read my blog. I really share everything.